So today we have 6,457 cases. Unfortunately, 63 people have lost their lives due to COVID-19. We've got 42 people still on ventilators across the country, so we've got to remember that there are some people who've suffered gravely with this disease. As the PM said, our numbers are looking very encouraging at the moment. We've had less than 50 cases a day over the last few days. Many of those cases are return travellers or contacts, but as before, there are small numbers of community-acquired cases where a source is not known. As I've said on many occasions, this disease can spread rapidly undetected very easily, and we've seen that in other countries of the world. In fact, we've seen a small outbreak in northwest Tasmania recently, where very rapidly a large number of cases appeared over a course of a few days. It's been expertly handled by the Tasmanian health authorities and an exemplar way of bringing an episode under control. But as the PM has said, if we relax the distancing measures that are stopping or reducing that community transmission, that will inevitably lead to some more outbreaks of community transmission. Unless we are prepared as a nation to detect those outbreaks really early and get on top of them and control them and isolate the cases and quarantine the contacts, we could end up with large community outbreaks that could lead to situations like we've all seen every night on the nightly news in high-income countries with good health systems like the USA and the UK. We cannot afford to do relaxation until we have a public health system which is so finely tuned that it can detect and respond to any outbreak. That's the message that we gave to the National Cabinet today. Like anybody, HPPC is very keen to see some of these distancing restrictions removed, but we're not confident just yet that we have a public health system that is so completely prepared that we can guarantee to government that we'll be able to deal with any outbreak. Our public health system is one of the best in the world, and I'll show you some data on that in a minute. But we just have to hold the course while we get ourselves completely ready so that we can live through these next difficult months together. What I'm going to do now is show you some of the modelling. As we've agreed, we're going to be showing all of the modelling that the University of Melbourne modelling team working for HPPC and the Commonwealth Department are doing, and they're going to release a paper this afternoon using some early Australian data, and I think you've all got a handout showing these slides, so we'll just go through it. So what we're showing you now is some modelling that's based on real Australian data, and this is the sort of information we're going to use to understand this epidemic as it progresses over the next months. We're going to start using a concept of nowcasting instead of forecasting, which is able to use current data to identify what's happening at the moment and what's likely to be projected to happen in the next fortnight. We'll be able to review the effectiveness of our current measures and be prepared to respond to future changes. We have the next slide. So you've all seen these graphs, and you can see the flattening of the curve, and you can see the progressive drop in numbers of new cases. A very gratifying outcome, but again, one about which we cannot be complacent. Next slide. So two measures we're looking at today. One is a model that's developed by the London School of Hygiene and Tropical Medicine to assess countries on the effectiveness of symptomatic case detection. This uses a model which you can get in the paper when it's published this afternoon to show how likely it is that a given country is actually detecting its cases. And as you will see, as we come to this, we are doing very well, and that's probably one of the major reasons we have done so well in controlling the early phases of this pandemic. The other bit of data we're going to show is the Prime Minister referred to the effective reproduction numbers. You're all now familiar with the R0, the basic reproduction number of the virus, and we think it's about 2.5 for the coronavirus, but the effective reproduction number is the number of people each case infects after we've mitigated and controlled it. And obviously, if we get that below 1, we can control and reduce the outbreak. So it's a very good measure of our mitigation and control strategies. Next slide. So this is showing across Australia the symptomatic case detection rate. And according to this model, which will be published today, we are detecting, in a model sense only, we could be detecting 100% of all cases, but their estimate is we're detecting, within the margins of error of this model, about 92% of all symptomatic cases. And you'll see that there are different predictions for each state. These are showing 4 states here, but they're all very high. Next slide. And these are the other states, and all of our states and territories have a very high symptomatic case detection rate. What that tells you is that our testing regimen, our surveillance regimen is highly effective. And to show you that more starkly, we'll look at the next slide. You see, it's very hard to read. People on TV probably can't see it, but right down the bottom of that slide is Australia, which is ranked the highest in this model of all of those countries in its symptomatic case detection rate. The estimates are showing that we are the most likely country in the world in this modelling of the countries shown here to be detecting our symptomatic cases. And their estimate showing that Australia has an estimate of 84% on this model. So that was very reassuring about our public health surveillance. Next slide. And this is this effective reproduction number that I talked about before. And we're showing it here for all states. And you can see there that South Australia, at Tas, I think the other 2 states have dropped off the bottom there, but you can see Tasmania down the bottom there is showing a little kick up. And we expect to see that because of that little outbreak in Burnie. That shows how sensitive this measure is. That'll drop away very quickly as that outbreak's brought under control. And you can see then the other 3 states there, New South Wales, Queensland and South Australia, that the effective reproduction rate is well below 1, showing that the epidemic is reducing. Next slide. And this is showing Victoria and WA again below 1. So what we're showing here is the measures that are being used to monitor the outbreak on our real Australian data, the measures that we've got to reassure us that our public health surveillance is good and our response measures are good. But as I said earlier, our public health response has to get even stronger if we are going to be able to relax distancing and take us through this pandemic with the least amount of social disruption but the best possible public health control.